One Monday morning in 1990, when I was an infection prevention nurse in a 400-bed hospital in Long Beach, California, I arrived in my office and started to check my messages, which was my normal way of starting my day. And much to my surprise, I heard a very excited voice saying, "Come down to the emergency room immediately." I was really taken and raced down there and got the very, very upsetting news that a young child had arrived in the emergency room over the weekend and had been pronounced dead on arrival with the diagnosis of measles. Well, that was just the beginning of months and months of many more cases and unfortunately more deaths. And one of the communities that was most vulnerable was the Samoan community. The children were not vaccinated, and the health department was very helpful in really taking a lot of time and energy to focus on that community, to educate the parents and to support them, to have them understand that in order to protect their children, the children needed measles vaccination. Another event that happened as a result of this was to look at what had happened. Why were we having outbreaks? And up until this point, the recommendation was for 1 dose of measles, mumps, rubella vaccine, but then it was decided that was not going to be sufficient. So a 2nd dose of measles, mumps vaccine was recommended, and it has been very, very successful to present day in preventing outbreaks and preventing cases of measles. And I wasn't really alone in going through all this. I'd be remiss not to mention I had a very important partner, and they were just a phone call away at the Centers for Disease Control and Prevention, a group of experts that were just an invaluable resource.